Um, Hello to everyone. The next speaker is Dr. Prashant Vishwanath. His topic is gut microbiota and its implications in health and disease. At the very outset, I'd like to introduce myself. I'm Dr. Sarkar, Professor of Biochemistry at AVMC Medical College. And now Dr. Channa Virappa Bamigati would introduce the chairperson. He would introduce the speaker. And Dr. Channa Virappa Bamigati did his MBBS from Karnataka Institute of Medical Sciences, Hubli, Karnataka in the year 1997. And he did his MD Medicine from All India Institute of Medical Sciences in the year 2002. Currently, he's the Professor of Medicine at JIPMER, Puducherry. He has 15 years of experience in teaching and patient care in the field of medicine. And his fields of interest are tropical diseases, clinical toxicology, hypertension, and rheumatology. He received the J.N. Berry Award for the best free paper at MICROBIOME 2016, held at Hyderabad. Around 31 publications in PubMed Index journals. I'm sure this is his CV in very, very brief indeed. So I hand over the responsibility of introducing the speaker to the chairperson.
Thank you, Dr. Sarkar. It was a very nice introduction. So now I have the pleasure of introducing the speaker for the next talk, that is Dr. Prashant Vishwanath, who is going to talk about gut microbiome and its implications on the disease and health. So there is a say, I want to start with a saying in Kannada. I'm from Karnataka basically. So it says that I will tell the quote and then I'll tell the meaning. So maatu ballavaniಗೆ ಜಗಳ ಇಲ್ಲ, ಊಟ ballavaniಗೆ ರೋಗ ಇಲ್ಲ. So what it means is that the one who knows how to speak will not have any fights. And the person who knows what to eat, how to eat, will not have any diseases. So it translates like that. So I think gut microbiome has a lot to do with this saying. So to talk about this more in detail, we have Dr. Prashant Vishwanath, who is the Professor of Biochemistry, but also the Director of Research and Coordinator of Internal Quality and Assessment Assurance Cell in JSS Academy of Higher Education and Research in Mysuru. And he obtained his MBBS degree into the year 2000 from JN Medical College, Wardha, and then he did his post-graduation from Kasturba Medical College, Manipal in year 2005, and then he obtained his PhD from JSS Academy of Higher Education and Research. Then he also holds a FAMER fellowship, and he has done advanced course in medical education from St. John's. He has established Center of Excellence in Molecular Biology and Regenerative Medicine in Department of Medicine at JSS Mysuru, which is a commendable work, I feel. He has up to 25 crores of funding from various funding agencies, which is commendable again. And he is a coordinator and PI for many of the projects funded by many funding authorities. He has more than 58 publications in reputed journals. I think people will be benefited greatly by his talk, and I'm also eagerly waiting for his talk. Over to you, Dr. Prashant.
Thank you very much, Chanvirappa sir, for the introduction, and thanks to Gautam Sarkar sir also. It's a pleasure and honor to be here amongst the August gathering and give a talk in this platform. I'm really humbled by the RPDVD Medical College for giving me this opportunity, and also Dr. Manju, who has been coordinating with me for the presentation for this topic. So thank you one and all, and I welcome once again all of you for this workshop, very well organized organized conference. Thank you, everyone. So my topic is mainly on gut microbiome, its implications in health and disease. Of course, this topic has been of quite interest, and my interest in this topic has mainly come up in the last 2 years. Once I started reading and listening to about what implications the gut microbiome can have and how it affects the various health and diseases especially. And today's talk, I'm going to focus mainly on 3 systems. One is mainly the cardiovascular system, the lungs, as well as the liver. So we all know that we don't live alone. So though we might be alone in this room or this thing, but with us, there is a harmonic coexisting of millions of microbes within the human body. And these microbes have minimized the competition for nutrients, the immunological imbalance, digestion of complex indigestible substances, and they also help in synthesize vitamins, and they influence appetite and enhance the energy metabolism. And this microbiota should be considered as a key aspect in nutrition. And I'm sure the next year, that is the year of millets, is also going to add a lot on the microbiota and how it is being influenced. So the beneficial microbes, they protect the humans from harmful colonizing pathogenic microbes. And in today's talk, my whole objective is what could be the good microbes that are existing within our gut, and what are the microbes which are infested or the concentration or the count of these microbes increases in certain diseases, right? So targeting the gut microbiome with probiotics or dietary fiber benefits human health. And this was the prime concept in which I had written the DST first project, and that is how it was successful. Of course, we had written a lot of it in detail. I cannot discuss the entire thing in detail today due to paucity of time, but I'll try to give a glimpse of how these microbes could affect the health and disease. Not only that, they also have the potential in reducing obesity. They could be the targets, and it provides an exciting opportunity to improve management of many of these diseases. We know that these microbes, they could get affected by the ingestion of drugs, the food that we eat, the antibiotics, the pesticides, whether it is in the food or whether it is in the environment, and many other factors could all have an adverse effect on the gut microbiota. And the published literature says that many complex diseases are known to be negatively influenced by the dysfunctional microbiome, which includes obesity, type 2 diabetes, rheumatoid arthritis, fatty liver disease, inflammatory bowel disease, chronic obstructive pulmonary disease, Alzheimer's disease, Parkinson's disease, schizophrenia. So there is a lot of interest on this altered microbiome or dysbiosis and the various diseases which are affected by this dysbiosis. Right? So what happens? This is just a schematic representation of the role of gut microbiome in health and disease. On the right hand side, we have the healthy how it can positively influence the body, and on the left hand side we have how it could negatively influence the body, that is in disease and in health. So the gut microbiome, or it could have a positive intake. It could be a bilateral relationship. The dietary fiber intake can bring in a good microbiome or a positive microbiome. There could be a probiotic intake can also influence the gut microbiome. It could make it as a healthy gut microbiome. And when we have the healthy gut microbiome, there could be an increased short chain fatty acid production. There could be increased anti-acid productions, that is indole propionic acid. There could be decreased indoxyl sulfate production, which is a kidney toxin. There is an improved lipid metabolism inside the body. There is low gut inflammation. There is an increased insulin sensitivity and reduced risk of some infections. So when we have a positive or a good gut microbiome, these are the positive effects that we see inside the body. But on the other end, when we look at the disease patterns or in the disease or in altered health conditions, the main influence is altered pH. Whenever there is an altered pH, that is a more of acidic pH or an excessive consumption of protein or sugar intake or saturated fatty acid intake or proton pump inhibitors, these are known to negatively influence the gut microbiome. That is, the microorganisms which are favorable are reduced in number, and the microbiomes which are not favorable for health are increased. So these are the factors which could change the gut microbiome, and this leads to a reduction in the short chain fatty acid production, an increase in the trimethylamine N oxide production, an increase in the lipopolysaccharides production. All these things, they increase the risk for cardiovascular disease, gut inflammation, insulin resistance. There could be a cognitive decline, and also there could be increased risk of diarrhea. Now, the short chain fatty acids I'm going to discuss more in detail when I go through my next, when I go through further in my presentation. But the trimethylamine N oxidase, the TMAO, has been shown to increase in chronic kidney diseases. Its levels have been shown to increase in CKD diseases, and this has led to increased incidence of cardiovascular diseases in renal failure patients. So it has been an established, there is an established relationship between this TMAO and cardiovascular diseases, and hence this gut microbiome, which can increase the TMAO concentration, can again lead to an increased risk of CVD and other diseases. Right. So what happens in the what happens to the gut microbiome in various diseases is basically, I've just taken these things from the literature. In obesity, what are the taxonomic features? In type 2 diabetes, what happens? In cardiometabolic diseases, and in metabolic liver disease, and in malnutrition, what are the different patterns of the microbiomes? So in the obesity, we see that there is a decrease in bacteroids to firmicutes ratio. There are decreased concentration and increased concentration of the various microorganisms, which has already been published. But what happens is mainly there could be an increased low gene count, or there could be an increased high gene count, which leads to production of organic acids. There could be increased phosphotransferase system, a decreased glycosaminoglycan degradation, increased glutamine. So there are a lot of changes which could take place in the obesity because of an altered gut microbiome. That is, the pattern of gut microbiome changes. So there is a shift from the healthy microbiota to the dysbiosis. There is a change. Again, if you look at type 2 diabetes mellitus, again there is a change. There is a decrease in concentration of some of the normal gut microbiome, that is a microbiome which is existing in the gut, and there could be increase in certain microbes like Clostridium species, and these Clostridium species are known to increase the pH, that is acidic pH, and it is going to cause functional features like increased membrane transport of sugar, increased BCCA transport, decrease in the short chain fatty acid production, and decrease in the metabolism of cofactors and vitamins. Similarly, if you look at the published literature and the relationship of gut microbiome in cardiometabolic diseases, there is again literature which shows that which of the microorganisms could be decreased and some of the microorganisms are increased. Right. In metabolic liver diseases, again, we have got certain microorganisms which are decreased or certain microorganisms which are increased. So basically all this, whenever there is a shift from the healthy microbiota to the dysbiosis, whether it is either in any of these diseases, whether there is an increase or decrease of the microbes which are not favorable, then we see the biochemical effects, and these biochemical effects can lead to further worsening of the disease, or it could lead to severity of it would be related to the severity of the disease. So this gut microbiome, the story of the gut microbiome starts with the birth itself. So even the birth plays an important role, whether it is a cesarean delivery or a vaginal delivery. If you look at the literature, it says that the microbes which are related with cesarean delivery are, there is an increased concentration of bacteroids in the infants born with cesarean delivery. There is an increased concentration of Staphylococcus, Bifidobacteria, and Cornybacterium in infants born with cesarean delivery. Whereas the infants born with vaginal delivery, they show a higher concentration of Lactobacillus, Clostridium, and Pervotilla species. Right. So even the birth plays a very important role in defining the microbiome pattern in the infants. Also, as the age advances, there is a normal shift in the microbiome pattern in the as a infant grows to a child. There is an increased concentration of bifidobacteria, increased bacteroids, enterobacteria, and firmicides. Whereas in an adult, the pattern changes, the bacteroids concentration decreases, whereas the firmicides concentration increases. So this ratio of bacteroids to firmicides is very important in adults for maintaining the gut microbiome. As the age advances, again, it reverts back, the bacteroids concentration increases and the firmicides concentration decreases. Again, there is a altered ratio of bacteroids to firmicides. If you look at the concentration of microbes in the gut, the stomach has the least concentration, about 10:2 to 10:4. The duodenum is slightly higher. The jejunum has still higher concentration of the microbes, and the ileum, colon, rectum, and anus, they have the highest concentration of the microbes. So this is the increasing microbial numbers and the diversity. Even the diversity also increases as we go down through the gut microbe. So there is a variation with age. The normal pattern itself shifts as age changes, and also the pattern is distribution is different in the gut itself. Now, if you look at the normal commensals, the main normal commensals in the stomach are the lactobacillus species, followed by the propionial bacterium species, the streptococcus, and the staphylococcus species. Whereas in the small intestine, the pattern is entirely different. It is mainly dominated by the Escherichia species, the bacteroids, Clostridium cluster, the lactobacillus to a lesser concentration, Streptococcus, and Millionella species. In the colon, again, the microbe, the inhabitant microbes are different. Mainly the Alistrips species, the Anaerostrip species, the bacteroids, Bifidobacterium. So basically what happens, what I want to convey over here is the count also varies in the different organs of the gut, as well as the pattern of the normal commensals also varies in the different organs of the gut. Now, what do these microbes do? The microbes release mainly the biochemical parameters. So you might be wondering why a biochemist is talking about microbiology till now. But my interest mainly is on the biochemistry product itself. Like these microbes, they release many of the biochemical products. It could be gamma-aminobutyric acid, it could be tryptophan metabolites, histamine, polyamines, serpines, lactosepin, vitamins, short chain fatty acids, the long chain fatty acids, as well as the outer membrane vesicles. And all these biochemical amines or these biochemical peptides or these compounds can have their effect on the epithelium. They could have an effect on the immune cells. They could have an effect on the mesenchyme as well as on the enteric neurons. So these mainly metabolites could have altered epithelium, immune cells, mesenchyme, enteric cells. On the other hand, there could also be some non-favorable effects, like there could be production of bacteriocins, there could be increased concentration of hydrogen peroxide, there could be increased concentration of lactic acid, and again, these could lead to the harmful effects inside the body. So basically, though we are talking about the microbiome, we are talking about the biochemical metabolites which are released from these microbes, and these play an important effect in the various organs of the body. So in the beginning itself, I said I'll be mainly talking about three systems. One is the cardiovascular diseases, how they are altered, how they are propagated by the unfavorable gut microbiome, and the lung health as well as the liver health. So dysbiosis is a term referring to changes in the composition of the microbiota, and its metabolites have been suggested to play a pivotal role in propagating the inflammatory and metabolic diseases, including the GI disorders, cancers, cardiovascular disease, atherosclerosis, hypertension, kidney disease, heart disease, and many other diseases. But when I talk about heart, I did mention that it is mainly related to the trimethylamine N oxide, and this TMAO has already been shown to affect or have a relationship with cardiovascular diseases, mainly in the chronic kidney disease patients, because in CKD patients, the TMAO level increases. And similarly, it has been seen that some of the gut microbiome, when there is a dysbiosis, this TMAO level increases in the blood. And in fact, some of the therapeutic the new therapeutic targets are looking at TMO as one of them, how to reduce the levels of TMO to reduce the incidence of heart disease. So a better understanding of the regulation of the gut microbiome and intestinal function may lead to novel diagnostic and therapeutic strategies, and that is what I was trying to tell, that a lot of these things are being looked upon as potential targets now. And it has been shown that these atheromatous plaques of patients with coronary artery disease contains pathogenic bacteria like microbiome like Staphylococcus species, Proteus vulgaris, Klebsiella pneumonia, and Streptococcus species. So how does this happen? And I've just put a representative diagram over here. So there could be, first thing is there could be a dysbiosis, that is a shift from the favorable gut microbiome to an altered gut microbiome. And when this dysbiosis is happening, there could be certain microbiome and its metabolites which are getting released. And these metabolites can have effect on GI disorders, cancer, type 2 diabetes, obesity, hypertension, atherosclerosis, and heart disease, right? Now, when we look at the gut microbiota, I did mention in the first slide itself that yes, it mainly increases the concentration of short chain fatty acids. And these short chain fatty acids, they again lead to further biochemical pathways, which lead to high blood pressure, mainly the renin pathway as well as the SMA pathway. They increase the concentrations of these, and then it leads to high blood pressure. And this high blood pressure could be a risk factor for the cardiovascular disease. So again, there could be another way that high salt again causes dysbiosis, and there is a decrease in the lactobacillus species. There is an increase in the concentration of IL-17 and other inflammatory markers. And these could lead to high blood pressure. What could reverse it is probiotics containing the lactobacillus species or a vasodilation. The other pathway, if you activate the other pathway, there could be a vasodilation and reduce in the blood pressure. So this is one of the mechanisms by which the gut microbiome could alter the high blood pressure, mainly by release or increasing the short chain fatty acids. So what happens is the dietary nutrients, there could be carbohydrates, and these could increase the short chain fatty acids. There could be increased energy availability. There could be increased HDAC inhibition or GPCR signaling. On the bile acids, there could be secondary bile acid synthesis, and this could increase the BAT activation or energy expenditure, as well as increase inflammation and insulin sensitivity. The microbiota could also increase the lipopolysaccharides concentration as well as peptidoglycans, and this could have an effect on reduced reverse cholesterol transport. There could be an increased insulin resistance, hyperlipidemia, and increased vascular inflammation. So that's how it could affect the liver, the cardiovascular disease, as well as the kidneys, as well as the lungs. So mainly the TMO plays an important role in the kidney disease. I did mention about that. So that was about the cardiovascular disease. The cardiovascular disease increasing mainly because of the TMAO concentration as well as the short chain fatty acids, and these short chain fatty acids increase the hypertension. They increase susceptibility to hypertension, and this could again lead to an increased incidence of cardiovascular disease. Coming to gut microbiome and lung health, there has been a lot of interest which has been generated off late, and the gut-lung axis has been an area of interest for many of the researchers. The gut and the lungs, they are anatomically distinct, and but what could be common is the microorganisms or the microbiota which inhabit these organs. And there could be a lot of communications as well as complex pathways involving their respective microbiota. And this has led to the existence of the gut-lung axis. Compared to the better studied gut microbiota, the lung microbiota is only been of interest in the recent years and represents a more discrete part of a whole microbiota associated to human host. So while most of the studies focus on bacterial component of the microbiota in healthy and pathological conditions, recent works have also highlighted the microbiota and the virobiota, that is the contribution of the fungal and viral kingdoms at both the digestive as well as the respiratory levels. And the recently emerged gut-lung axis concept involves host microbiome as well as microbe-microbe interactions based both on localized as well as on the long-reaching effects. Rather than telling anything, I can just go to this image which explains the relationship between the microbe biota in the lungs as well as how it interplays, how it plays an important relationship with the gut microbiota. So there is a lung immune system, and this lung immune system is mainly regulated by the lung microbiota, which could include the bacteriobiota, predominantly the bacteriobiota, but also there could be existence of microbiota as well as the virobiota. So these these have a crosstalk between the gut microbiota because of the pathways which are activated by these metabolites which are released from the lung microbiota, and there could be an increase in the, or there could be activation, or there could be kind of effect on the NFK beta dependent pathway. There could be increase in the IL-25, IL-13 prostaglandin, and so both of these microbiota, they have an interrelationship, and there is a lot of crosstalk between this, and each one influences the other, the presence of the other microbiota, or alters the microbiota in the gut. So the gut could play an important role in the lung microbiota could influence the gut microbiota. And what happens and how it is related to the common lung diseases. So the gut disturbances include disturbances in the lung diseases include has been studied in many lung diseases like allergy, asthma, COPD, cystic fibrosis. And what has been seen is that there is an altered concentration of bacterioids, firmicutes, and proteobacteria, and these predominate in the lung, and in terms of species level are significantly different. So many lung diseases have been seen, and it has been seen that there is a pattern in each of the lung disease. Coming to the final part of it is the liver. A lot of interest has again been evolved in this liver because of its direct effect on causing fibrosis and liver cirrhosis. So the gut microbiota has recently evolved as a new important component in the pathophysiology of intestinal and extra-intestinal diseases. And the liver is an organ which is in closest contact with the intestinal tract, and it is exposed to a substantial amount of bacterial components and its metabolites. And this dysbiosis may influence the degree of hepatic steatosis, inflammation, and fibrosis through multiple interactions. And we'll just see through certain pathways, which are the pathways which are activated and how it leads to the fibrosis of liver and leading to liver cirrhosis. So whereas a few results from large metagenomic studies are available, evidence is accumulating that in liver cirrhosis, an oral microbiome is overrepresented in the lower intestinal tract, potentially contributing to the disease process and severity. So a major role for gut microbiota in liver disease is also supported by the evidence that several complications of severe liver disease, as hepatic encephalopathy, are efficiently treated by various prebiotics, probiotics, and antibiotics. So though we have been using these treatments for the hepatic encephalopathy, it also relates that these prebiotics, probiotics, and play an important role in altering the gut microbiota, and that is how it is improving the hepatic encephalopathy. And if you look at the change in the gut microbiome in the liver diseases, so there is a eubiosis when we have a healthy liver, and there could be a dysbiosis when we have a liver fibrosis. And in the liver fibrosis, we see that there is a change in certain phylum, like there is an increased concentration of firmicides, acetobacteria, fusobacteria, and there's a decreased concentration of bacteroids and increased concentration of proteobacteria. So all these things could lead to certain biochemical changes. There are pathways which are altered, like the COL1A, TIM1, the TGF-beta, ZO1, BCL2. All these things could be increased or decreased, and this could favor a liver fibrosis. So this is how the relationship has been established, that there could be a change in the phylum Of course, there might be again a debate that we have looked into. There are studies which have been done in after the fibrosis has set in, but even otherwise, there are studies which have long-term looked into the change in the phylum and how it has led to liver fibrosis. So how this dysbiosis can lead to liver fibrosis. So several diseases have been found to be influenced by the processes in the gut microbiome that have been implicated in interactions with certain drugs, including some psychiatric medications. And even the cirrhosis patients have a altered gut-liver axis related to the gut and systemic inflammation. And with the studies reported, a species of Lactnospiraceae and Ruminococci are associated with the development of the cirrhosis. In addition to these changes, it is demonstrated that alteration in the function of bacteria, which includes release of endotoxin and decreased conversion of primary bile acids to secondary bile acids, may also lead to cirrhosis. Therefore, it's summarized that the modulation of the gut microbiome plays an important role in the progression of cirrhosis. So I just spoke today about three important diseases, organs, mainly the cardiovascular disease, the liver, as well as the lung health. So how this gut microbiome can influence, the altered gut microbiome can influence the diseases, mainly in the cardiovascular disease, the liver diseases, and the lung diseases. But nonetheless, a lot of interest has been generated to revert back these altered microbiome into the normal microbiota. And if you look at the microbiome directed interventions which are there, it could be targeted or it could be untargeted. There is literature which shows that physical activity or exercises changes the gut microbiome in a favorable way, and that is why it is like, there could be certain untargeted interventions, or there could be targeted interventions. The untargeted would be physical activity, that is exercises, then individualized nutrition for a person. Transplantation of fecal microbiota has been tried in various conditions with success. Then also introduction of prebiotics, probiotics, and symbiotics, as well as postbiotics. And all these things have been shown to have a general improvement in microbial composition and functions. When I said in the beginning that the next year is the year of millets, there is a lot of interest, and our research is mainly on the millets. Especially we are studying on kodo millet, which is and how this kodo millet is altering the gut microbiome. We have published a few papers. I have not included that research work over here, but definitely over a period of time, we still have we are in the I should say a native stage of looking at the microbiome. In fact, we are looking at many other interventions also that in various disease and health conditions. There could be certain targeted microbiome directed interventions. So there could be bioengineered commensals. There could be drugs targeting the selected microbial metabolism. There could be phage therapy, as well as of late the interest is on CRISPR-Cas based therapy. So all these have a potential to alter the unfavorable gut microbiome into a favorable gut microbiome. And it still remains, to be seen that yes, if these diseases could be, the incidence could be reduced, or at least it could be altered by altering the gut microbiome into a favorable one. So this was what I wanted to talk about today. I would be happy to take up certain questions, or and thank you for patient listening.
Thank you, Dr. Prashant. That was a very nice and elaborate talk on gut microbiome and how it affects the health and diseases affecting the heart, lung, and liver. It was very interesting. So thank you for finishing your talk within the time. So we can ask, we can hand it over to question answers.
May I make a few observations, please?
Yes,
sir. I really loved you. This thing is topic is very close to my heart. You had mentioned about prevotella during vaginal delivery, and I think some surgeons, they are in fact cesarean babies are given vaginal fluid through mouth to put in prevotella nowadays in some places. In your talk, you were talking about the virus, bacteria, etc. I wonder whether protozoa and helminths could be brought into the picture. I'm not sure. That is one issue. Third is a point, your topic is so interesting. I wondered if we can organize a workshop on gut flora analysis somewhere. Next point, I'm going very, very fast indeed. With 40 trillion eukaryotic cells in our body and 100 trillion prokaryotes in our gut, I wonder whether we are eukaryotes or prokaryotes. That's a very fundamental issue that I have. Now, you had also raised about the lung problems would be contributed by helminth, this thing. But even helminthic larvae can contribute to lung problems. And last is, what would be the role of gluten, which is a very modern this thing we always talk about on the gut flora.
Thank you, sir. You raised a lot of interesting questions, and in fact, protozoa and helminths, definitely, sir, there is interest. People are looking into it, and it could also influence the gut microbiome as well. So there is, literature that yes, it could also have an influence on that. And yes, sir, you have most of it was an add-on information what you also gave. So we'll also look into it, and it's interesting to look into the gut flora probably on a separate platform. That what could be the flora, as and when probably we also go ahead with our research, we are also trying to develop certain models, animal models. We are working on certain animal models where we are trying to have a kind of a phenotypic microbiome. So what could be the kind of a model to conduct therapeutic studies. So right now what is happening is people are inducing or giving probiotics or prebiotics in a condition where we don't know the microbiome. So we are trying to develop a kind of model where we have a fixed microbiome, and then we try to test the medication. So some of the things probably next time I could share more on that.
We have a question from Dr. Koshi here.
Thank you very much. Dr. Prashant, thank you for your excellent talk. Every word was truth. I am Dr. Ipan Koshi. I'm a plastic surgeon in AVMC. I have two questions for you. Yeah, we had a recent pandemic, and we saw a lot of patients going into ICU and getting the lung cytokine storm. Do you personally think, which I do, that they all had a fundamental gut dysbiosis to begin with? That is what put them into the ICU and the cytokine storm and possibly fatality that occurred. Has there been any papers, or what is your viewpoint on this? My second question is, you talked about prebiotics. In the Indian diet, which are the two main prebiotics that would come to your mind? Could you share that with us? Yeah. Thank you very much, sir.
Sir, with regards to your first question, the cytokine storm, definitely I will also look into the literature, sir. But like you feel, I also feel that there could be a predisposition of patients with having a altered gut dysbiosis, and that could have probably predispose them or expose them to this cytokine storm. There could definitely be a relationship there, sir. I will also look into the literature, but on a personal note, I also feel that yes, there could be a relationship. For the second question, sir, that was related to
prebiotics in the Indian
prebiotics.
diet.
The prebiotics, of course, millets. I did mention that millets are some of the Indian foods that have got a favorable this thing. They convert the unfavorable microbiome into a favorable microbiome.
Thank you.
Thank you very much, everyone, the speaker, the chairpersons, and it was just remarkable. And the mementos.
1 minute, sir. I would, sir, Prashant, sir, and Chanavirappa, sir. I'm Dr. Manju, sir. Thank you very much for accepting our invitation and presenting such a wonderful talk, as well as sharing this session, sir. Thank you very much, sir, personally from my side, sir. Thank you, sir. We would like to honor you, though it's a virtual mode, with a certificate and virtual memento. Please, with a certificate. Yes.
Thank you very much, madam.
Next, I would like to honor our chairperson, Chanavirappa Pamigatti, sir, with a certificate and this thing.
Thank you, Dr. Manju, and for a very nicely organized conference. Thank you. Thank you for inviting me.
Thank you, sir. Thank you very much. It was
Thank
our
you.
honor, sir, to have you both on this stage. Thank you, sir.